set.
Yeah.
So if the patient has a headache when they come in, do two different potential variations. They're Mulligan techniques. One's called a headache snag and the other is a reverse snag. So the first is you're coming through and with your pinky, you're finding C2, and then you've got it gently right on the back side of the spinous process of C2. You come in with kind of the lateral border of the thumb and thenar eminence, and you're giving a straight PA glide. It's very gentle. I mean, I'm kind of cupping her head, barely any movement. And what you're doing is you're seeing if that resolves her headache at all, or his headache at all. You hold it for at least 10 seconds before you decide if it's making a change in the headache. If you need to, you can kind of give a little bit of a left or right rotational pull to it, or push to it to see if that does something better. But if it does start to help the headache, you just hold it until the headache's gone. If it doesn't, after 10 seconds or so, maybe trying a couple variations of the right and left and seeing if those work, I'm tilting her a little bit more forward. Now my pinky is right at the occiput, and with the lumbrical grip, I'm trying to get around to the lateral, kind of almost like T processes of transverse processes of C2, and like gripping like the whole back side of the neck, but primarily trying to grab a hold of C2. And now the PA is through the occiput, and I tilted her just a little bit forward because they say it's important to not have them move into extension as you do this. And again, it's a very gentle, very small amount of movement. So I'm just kind of holding on to C2, PA on the occiput, not letting her go into extension at the suboccipital joints. And then again, you know, is this headache or is it helping the headache at all? If so, great. We're just going to hold it until it gets as good as it can be. Sometimes this will totally abolish a headache. Right, and then I just slowly ease out of it. So that is, you know, when I have a current headache, the snag and reverse snag suboccipitally for the headache.